Gambia Red Cross Society intensifies efforts in supporting families to let their loved ones rest. Africa CDC has raised concern over the increase in COVID-19 infections on the continent. And Ugandan tourism sector resumes operations after months of lockdown amid the impact of the COVID-19 pandemic. This and more coming on The World Today. Many thanks for joining us, and you are watching the World Today News Bulletin on Africa TV. I am Amadou Kante, and now the news in detail. Now, as the number of the COVID-19 related deaths reaches 32 in the country, pressure is mounting on the country's voluntary service provider. Many people are calling on the Gambia Red Cross to help bury their loved ones who died at home. Fatmata Fati has more in this report.
As the number of COVID-19 related deaths clocked 32 in the country, more pressure is mounted on the country's voluntary service provider as more and more people continue to demand for their burial services at the community level. Since the Gambia began recording community transmission, the Gambia Red Cross Society has eventually become one of the busiest institutions. This is because they are not only conducting burial for people who are said to have died with the coronavirus, but also picking up corpses from communities to the hospitals. Of recent, they are also forced to conduct burial rites for families whose loved ones died during this period, but aren't sure of the reason for their deaths. Head of Disaster Management at the Gambia Red Cross Society, Buba Dabo, said initially they only conduct burial activities of the names given to them by the ministry, but their mandate has changed as they also receive calls from family members to help in the burial of their loved ones.
Death-related cases of COVID were called by the ministry. Every day they will send us the list of names that we should support in burying. That's from the Minister of Health. But for the community cases, we receive calls from the community members themselves. Some of them are family members that will call us to say, we heard that Red Cross is responsible for burial processes and the like. Here we have our loved one who passed away, and then we want you to come and help us to transport the body to the health facility. Yes.
Mr. Dabo said they have buried 56 bodies so far since the local transmission started. He was quick to add that not everyone that they buried is COVID-related death.
Over the 2 weeks period now, we've buried almost 56 bodies. And not all of them are COVID positive, as I said before. 19 or so, because we bury ahead of the results. Some of the results coming out now, some of those bodies are even buried already, but the test results are just coming out. So we bury some bodies before the test results are out. Their samples are collected, but the results are not out, and the family requested to bury their loved ones, and then we bury them through the SDB process.
The disaster management boss said many people die of illnesses different from coronavirus, adding that people fear of being tested and eventually being moved into quarantine.
It can be other related diseases because people fear not to go to the health facilities for some medical checkups because they think if you go to a health facility, you are checked up with COVID, you'll be quarantined. People can die as a result of some of the communicable diseases, not even COVID. But it's the impact of COVID that is also escalating some of these other related diseases because people are not visiting the health facilities.
He advised those in denial to take the virus seriously rather than wait to be consumed. The Gambia has since reported 32 COVID-related deaths and 1,346 positive cases. The total number of recoveries stands at 227.
And that report was filed in there by Fatoumata Fati. And from that, next we head to Uganda, because the Ugandan tourism industry has resumed business after months of lockdown due to the COVID-19 global pandemic. Last year, the country collected more than $1 billion in tourism revenue from foreign visitors, but that trend is likely to change as borders remain closed. Authorities have also put in place health safety measures to avoid visitors contracting the virus. Here's more details of that.
These are the new attractions at the Uganda Wildlife Center. This breed of tigers was imported from South Africa before the outbreak of COVID-19. They are yet to be opened for public viewing, but that will soon change as Uganda is poised to reopen its doors to visitors.
We have now put in place the standard operating procedure for the entire value chain in the tourism sector. If you're a photographer, you're a driver, you're a tour guide, you're a travel agency, you're a tour operator, you're accommodation owner, restaurant, we have the SOP for all these. So that is the confidence we have that we are now all set to restart tourism in Uganda.
The managers of the sanctuary have installed hand-washing containers at every major point of entry and will utilize temperature recording equipment. After 4 months of closure due to COVID-19, this wildlife sanctuary can now receive visitors. But tour operators are worried that the numbers are likely to be low because the airport and the borders are still closed. Tour operators now want the government to reopen the airport.
The lack of discussion about when the airport is going to be opened. A number of countries are now opening now for summer holiday tourism business. Uganda tourism is a very key aspect to our lives.
It is a concern shared by many Ugandans, including Stephen Rangezi, who operates a cultural arts center in the capital Kampala. It largely depends on foreign tourists.
The sustenance of the cultural arts has been depending purely on what we get from the guests, 80% of who were foreigners. Now, the closing of the airport and all the borders meant that these people no longer come. The closing of the shows have killed all, and I mean all, the revenue.
From arts to animals, tourism has been one of Uganda's top foreign exchange earner. Figures from Uganda Tourism Board show that in 2019, the country collected $1.6 billion in tourism revenue from foreign visitors. But now, local authorities are promoting domestic tourism as they monitor the pandemic.
We have to adapt to these changes, and one of the things that we have adapted to is to think more inward, to establish ourselves more inward and become more self-independent, reliant. And in tourism, what we are doing with that is to be able to develop the domestic tourism.
The past years have seen 1.8 million tourists annually, of which 1.3 million were foreigners, while 500,000 were local tourists, according to the Tourism Board. And with many countries opening up and airlines beginning to fly, tour operators hope tourists from far and near will soon come back again.
And from the report in Kampala, Uganda, we come back home and report on the matters of the COVID-19, because on the day that the Gambia registered the highest number of COVID-19 related deaths, it also saw a drop in the number of positive cases. The Daily Situation report stated that there were 9 new deaths, the highest documented in a single day. It also reported that there were 111 new confirmed cases and 227 recoveries since March. This means the Gambia has since reported 32 deaths and 1,346 confirmed cases. The 115 National Situation Report also indicated that there were 301 laboratory test results received from the Medical Research Council and the National Public Health Laboratory. Out of these, 111 tested positive for COVID-19. 6 were discharged and 13 people were newly taken into quarantine. The situation report indicated that the country currently has 335 people in quarantine, more than 1,000 active cases and 145 probable cases, and a crude case fatality ratio of 2.4%. And from that report on the situation of the COVID-19 in the Gambia, we will now take a break and come back shortly with the remaining of the stories. Stay with us, we'll be right back.
Debunking COVID-19 myths. Myth 1.
Gis nga yow yaa ngi ree sa booba max bi ak tàngoor bi nii man gis nga man ragaluma COVID-19 coronavirus mënul da téye nit ku ñuul.
déedéet boy coronavirus dina jàpp bépp xeet dina jàpp bépp der dina jàpp bépp réew te gis nañ lum fi def ci réew yu nekk Afrika ak lu ko wër te Gambia ci la bokk COVID-19 lu am la yaa boo nga xam loolu.
Myth 2.
Suma chami. Ndax lekk laaj mën na laa aar si feebari coronavirus bi?
déedéet laaj dara firndelut ko continuer ci sa raxasam loxo mi te nga joxe digganteeg seen nit yooyu jokkalanteel te nga toppa sarta yi nag yuñ ñu tegtal pour nga mun cee muccaaleel si sa njaboot yeeg sa dëkkandoor yeeg ak àdduna si yëpp.
Myth 3.
Suma chami. Mbaa xam nga ne feebari coronavirus bi Gambia bokku parce que feebar bi mënut a dunda si réew yu tàngay.
déet soxna coronavirus daal mën naa dundee fu ne waate mu tànga wara mu seega wala si suñu réew mi dëkkandoor bi ñuy def daal saa su ne neen raxas suñuy loxo mën na génne jàngoro bu nekk suñuy loxo te ñuy moytu laal suñuy bët ak suñuy loxo wara bakket wara génne.
Myth 4.
Waaw nijaay.
waaw
feebari coronavirus bi maa dégg rek.
waaw
feebari mbirum taalat.
ku la wax
ñun
loolu
waa def ji bokkul foofu dara loolu feebari mbirum taalat.
déedéet yaa ngi nax sa bopp.
nijaay.
gis nga feebar bii dina jàpp ku nekk am na ñun jàpp si yeneenu tund fii si dëkk bi feebar bi lu xam la de te ñëpp lay jàpp nag wasalaam.
Welcome back, and you're watching the World Today News Bulletin on Africa TV. And now to the rest of the stories now. Following a rapid increase in the number of the COVID-19 and deaths in the country, a mass testing exercise was conducted on staff at the Petroleum House in Bigelow days after the Minister of Energy was confirmed positive for the COVID-19. Almost 100 samples were taken, out of which 13 of the workers have been tested positive of the virus. Details of that in this report by Khadija Tuseka.
Days after the Ministry of Energy tested positive for the COVID-19, the virus has been confirmed on at least 30 staff of the Petroleum House in Bigelow. The case of the Energy Minister, who together with 2 other cabinet ministers were admitted for treatment, initiated the need for mass testing of staff at the country's petroleum building, which is also hosting the National Petroleum Company and Organization of Islamic Cooperation Secretariat. Sources have informed iAfrica TV that close to 100 samples of workers in the building have been taken, out of which 30 have been so far been confirmed positive of the COVID-19. Unlike in this case with other institutions, the confirmation of dozens of cases didn't see a lockdown on the operation of the Ministry of Petroleum. However, the neighboring OIC Secretariat and the National Petroleum Company, GNPC, have both asked their staff to stay home to stay safe. The Energy Minister is among the second set of cabinet members to test positive of the coronavirus. following the news of the country's vice president admission to a treatment center for the virus. No further information has been made public on their status from the sanitarium, although the vice president has been discharged after full recovery from the virus. COVID-19 cases in the Gambia has relatively been underreported, with the health ministry justifying the situation with the overwhelming number of samples under the management of a few technical administrators. Currently, over 100 healthcare workers are under treatment for the COVID-19, most of whom got the virus on line of duties. For iAfrica News, I am Khadijatu Seka.
And from the report there by Khadijatu Seka, next we head to Tanzania, because Tanzanians have expressed displeasure as to the way they are disconnected with social and traditional activities thanks to the coronavirus pandemic. Unlike many countries within the region, the government did not impose total lockdown, but social events were limited to family members. Experts warned against complacency, noting that it is the need to adhere to the healthcare guidelines in their efforts to contain the pandemic. Let's have more details of that in this report.
Mangelangela's dream was to see her only child get married. Her vision for a big celebration was disrupted by a global threat, the COVID-19 pandemic. To protect its citizens, Tanzania's government imposed strict social distancing rules and banned big gatherings. The wedding went ahead anyway, with a limited number in attendance.
I was in shock. We have a big clan, but very few came to the wedding. Even the contributions to the cost were lower than I expected, so the whole wedding was on me.
Unlike its East African neighbors, Tanzania did not impose a full lockdown, but social distance measures in place caused unprecedented social and cultural breakdowns. Burials were limited to immediate family members, not exceeding 8 people.
One thing that is, I think, the most difficult is when it comes to the grieving. So a lot of people passed on, and a lot of people were not able to properly grieve, because again, funerals are more or less a ritual in which we used to grieve.
Tanzania is a diverse country made up of more than 120 ethnic groups. People from different tribes share strong feelings of unity that are expressed through collective social events. In Tanzania, like many African countries, it is common for many people to attend funerals, weddings, and other social events. Not being able to socialize and interact has caused a disconnect between families and friends. With the government now stating that COVID-19 is at negligible levels, communities here are slowly starting to rebuild relationship and try to get life back to normal. Behavioral scientists are optimistic as social distancing measures ease. They say personal behavioral changes, such as hand washing and wearing masks, are persisting and helping to create a more health-conscious society.
How do we maintain those social connections and social gatherings, but protect ourselves? And I think that's the biggest thing that we can take away as well, is that how do I protect myself? Because if each individual is thinking about how they can protect themselves, we can still have our social gatherings.
Medical experts say to end the pandemic, the virus must either be eliminated worldwide or people must build up sufficient immunity through infections or a vaccine. But it will be a challenge to change the culture of how Tanzanians interact with each other for the long-term good of its society.
From the report in Tanzania, finally we head to Ethiopia and report on matters of the Africa CDC, because the Africa Center for Disease Control and Prevention has raised concerns over the rapid increase in COVID-19 cases on the continent. The latest report of the Africa CDC highlights a significant number of recoveries in the region, but warns against complacency as the disease continues to spread across Africa. The health organization urged the public to adhere to the health professional guidelines in the fight against the pandemic. Here's more details of that in this report.
The report by the Africa Centers for Disease Control and Prevention shows nearly 68% of COVID-19 patients have recovered across the continent. It, however, notes that new cases are rising exponentially.
We clearly are edging towards the 1 million number, which will be a milestone. And I wish we didn't get there, but we should be very I caution that this is not time for us to panic and fear, but time for us to do what is right.
In order to flatten the curve, the Africa CDC alongside WHO has launched what is known as the Mask Week. It is an awareness program aimed at encouraging more people to play their part by wearing masks in public.
Let's mask ourselves in public. Mask, as Dr. Tedros used to say, test. This is time for us to mask ourselves constantly and appropriately. Second thing we need to do is to expand our testing aggressively and reduce the turnaround time. I really insist and emphasize on this, that the relevance of testing is not just to let people know that they are positive or negative. It has to have a public health perspective to it, which is we reduce the turnaround time, track those who are tested positive, and make sure that they are isolated appropriately.
Health officials tackling the COVID-19 pandemic are advocating for more community engagement.
Africa CDC will begin a series of community leaders engagement, that is religious leaders, civil society, opinion leaders, that will engage them in a very deliberate manner and make sure that they own this process. We build the trust with the community as much as so that they translate these messages into the various communities. That will be a top priority.
Africa CDC says that although the number of COVID-19 cases keeps rising on the continent, only 5 countries, South Africa, Egypt, Nigeria, Ghana and Algeria, account for 75% of infections across Africa. It maintains that for Africa and for the rest of the world, prevention still remains better than cure in dealing with the pandemic.
Africa Center for Disease Control and Prevention raised concern in the increase of the COVID-19 cases in Africa. And with that report in Addis Ababa, Ethiopia, we finally brings this news bulletin to an end. But for more details on this and other stories, as always, you can log on our website on africa.tv. Once again, many thanks for the pleasure of your company. Thanks for watching, and bye for now.